Hello, everyone, and welcome to my weekly blog. At AHS, we're very proud to live a culture of patient and family-centered care. What matters to patients and families drives everything that we do, and our goal is to provide patients and families with the best possible healthcare experiences. But in order to do that, we need to understand the unique culture and perspective of the various peoples that we serve. This includes the 220,700 Albertans who self-identify as Indigenous, making Alberta home to the third largest Indigenous population in Canada. It is so important to honor, recognize, and celebrate the strengths and resilience of the first peoples of this land. By focusing on these and building greater understanding and awareness, we can build a better and more inclusive health system. This work is championed by the Indigenous Health Team, who have built strong partnerships and nurtured relationships with Indigenous peoples, communities, and other key stakeholders with the goal of providing accessible, culturally appropriate health services for First Nations, Métis, and Inuit peoples in Alberta. Orange Shirt Day, which falls on September the 30th each year, serves as an opportunity for us to show a personal commitment to reconciliation and the creation of culturally safe environments for Indigenous patients and families. It is a movement of reconciliation that grew out of a former residential school student's account of having her brand new orange shirt taken away on her first day of school. You can learn more about this by visiting orangeshirtday.org. Wearing an orange shirt is meant to recognize the harm done to residential school students and show a commitment to the principle that every child matters. And with me today to tell us more about the Orange Shirt Day and the Indigenous Health Program are Marty Landry, Executive Director, Indigenous Health, Shannon Dunfield, Manager for Indigenous Health and Diversity North Zone, and Simon Ross, a Senior Advisor with the Cultural Competency Team. So welcome to all of you, and thank you so much for being here. As I mentioned, Orange Shirt Day is next Wednesday, September 30th. So starting with you, Simon, can you share your thoughts on the significance of this day and why we should be encouraging people to wear orange?
Thank you very much, Verna. I think it's vital that we celebrate Orange Shirt Day on September 30th. And as you stated, it's really important to honor the residential school survivors of the historical relationship between education and Indigenous peoples. And it really only stemmed from 1973 with Phyllis Webstad, who, as you stated, had her orange shirt taken away from her when she attended her first day of residential school. And so we're asked to recall that and remind ourselves about the importance of children. And that's why we say every child matters. But you also need to acknowledge the reason why September 30th is such a significant day. Because on September 30th, that is when the Indigenous children were picked up from the homes or from the reserves and taken away from their families to attend these schools. So it's a very significant day. And therefore, we do honor the survivors and the legacy of residential schools on this day.
Reconciliation is very important to me personally, and I know for all of us at AHS. So I'm just going to share a personal clinical story with you while I was reflecting myself on what I've learned. I don't know if you're aware, but in pediatric nephrology, Indigenous children have a disproportionate higher incidence of certain types of kidney disease. So I've dealt with many Indigenous patients and families in my clinical career and have very much enjoyed working with the children and families. But I still remember one incident where there was a young Indigenous girl who was on peritoneal dialysis, and we had to admit her into hospital because she wasn't receiving the treatment at home due to extenuating circumstances. And from a medical perspective, I didn't feel that I had any choice but to place her in another home setting where I knew she would get the life-saving care. But there were no homes from her reserve she had come from, and nobody had come forward to bring her back into their home. So we ended up looking to place her in a non-Indigenous family. And I still recall having a very lively discussion, probably more of an argument, with a band chief who was so angry at me for even considering taking her out of the reserve. And all I could think of was what I thought was medically best for her. And I didn't really consider anything else. So looking back, if I knew more about what I know now, about the impact of white privilege and residential schools, the 60s scoop, and the lack of trust with any authoritarian group, perhaps I would have approached it differently with the band leadership, and perhaps with further understanding, I could have collaborated in a much more empathetic and effective fashion versus what became really a win or lose scenario. So that was my story, and I still remember it to this day. And fortunately, she's done well, as do most of our kids, but it was a very difficult and tense situation. Shanna, I'm going to move to you. What are some ways that we as healthcare providers can create a culturally safe environment for our staff, patients, and families?
Thank you, Dr. Yu. First of all, thank you for sharing your story. That was very powerful and very moving, so I appreciate that. I think about what we can do. The course number one is, do the Indigenous learning courses. Learn about your communities close to you. Visit our First Nations communities, our Métis settlements, participate in community events like powwows and round dances. Learn how to do the Red River Jig. I can't, but I think you should learn. Everybody else should learn. If you're in an urban community, connect with our friendship centers and any other Indigenous organizations to participate and learn about the local culture there. Visit with our Indigenous staff. Learn about their roles, learn about, what they do to help our patients and our families while they're in care. And I think the biggest part for me is, let's not just do a one and done. Take the time to learn about our people, and you'll be more richer for it.
Yeah, thanks for that, Shanna. I've had the privilege of being in a few round dances, and I think one of the things I really appreciate about that is that it really brings everybody together as one. Like that, it was very powerful experiences for me. So following up on that, we have our mandatory Indigenous learning courses that we want to go through to build our collective awareness and understanding of Indigenous history and culture. So Simon, can you tell us a little bit more about these courses and what other resources are available for our staff in building those culturally safe environments?
So the required Indigenous learning can be accessed through My Learning Link, and it can be done through an e-learning module, and there's 8 modules to participate to complete the certificate. At the same time, we do provide face-to-face workshops, but during a COVID response, we're looking at how do we alternate that educational opportunity, and we're utilizing Zoom as a base to do that. So we've spent the last period of time with the team prepping and organizing and making sure that we got the technical support for it. And so now we're able to offer the Indigenous Awareness Sensitivity Workshop, which meets the required learning pieces in a Zoom environment. So you're able to log in through My Learning Link, or you're able to, as a manager or a leader, request for group learning, and we can accommodate as best we can. We do have new courses that are set up on My Learning Link at this time. And just a reminder that there's a numerous amount of Indigenous resources through the Indigenous Health website on Insight as well to support that learning.
So Marty, moving on to you, we know that one step in our journey to reconciliation has been to adopt an Indigenous health strategy. So can you tell us about how this strategy came about and how we're moving its actions forward, and why is this important for our relationship with Indigenous peoples?
Thanks, Dr. Yu. The Indigenous health strategy has been something that has evolved because of a number of different factors that took place over the past 10 years. One of them is that we've been working with Indigenous communities, and we've been working side by side with them at the zone level, certainly at the community level, and then at the provincial level, at some of the major tables. And the communities have been saying things like, you need to start listening to us. You need to act on what you're hearing, and you need us to be at the table to identify not only solutions to our needs, but ways that we can help you as a system to address our needs. And so the Indigenous Health Strategy was formed based on that understanding that we have been listening to the communities for a number of years. And then the United Nations Declaration on the Rights of Indigenous Peoples was released, and the Truth and Reconciliation Calls to Actions was released. And those 2 documents helped form the foundation for really looking at Indigenous health from a very strong foundational area. And what that really meant was that we need to recognize self-determination and the autonomy for nations to really identify what their needs are and to really bring their needs to the system. And then our job is to listen, to understand, to act, and to be, and to really show and work alongside Indigenous communities and say that we are listening and that we can and we will and we'll try and help you as the best way that we can as a healthcare system.
So we've been through a lot during COVID, and I know that all of you have been really involved with supporting our Indigenous partners, patients, and families through the pandemic. So over to you, Marty and Shannon. What are some of the ways that we've been working with our partners to support Indigenous communities during this time? And Marty, I'm going to start with you, maybe through the lens of the Provincial Indigenous Program.
The pandemic response came on very strong, and there is a real sense of urgency and worry within the Indigenous communities, both the First Nations and the Métis communities. And we recognize as a program and as a system that we needed to respond to the unique and special needs or circumstances of Indigenous people, especially the ones that lived on the reserves. And this idea of how do we form a relationship with communities, but also how do we form relationships with Indigenous Services Canada, First Nations Inuit Health Branch to really meet those specific needs. And so part of what we've done is set up an Indigenous Health Task Force that is linked directly into our Emergency Command Center, Emergency Coordinating Center. And then we work at our ZOC levels. So at the zone level, there are zone emergency plans. And then we work side by side with the communities. So our zone leads work specifically with Indigenous communities, the health directors, and at the zone level. And then we bring that information back to the ECC level. At the same time, we have relationships with Alberta Health, Indigenous Relations, and FNIB, and we work together to form at least some solutions to some of the broader issues and some of the bigger issues like jurisdictions that we have to deal with at that level. So we've created that table and we work very well with each of these groups.
Yeah, thanks for that, Marty. And I think what you've shown is the integration piece and you know, coming down from the federal to the province down to the zones. So Shannon, moving over to you, maybe you can elaborate on some of the work that you've been doing in the zone level and specifically in the North Zone.
I think one of the first things I would like to do is acknowledge our First Nations and Métis communities for the absolutely amazing work they have done since this started in protecting our communities. You know, our leadership at the First Nations and Métis level have done everything to ensure the safety of their people, and we're just so very blessed to be able to work with them and support them in that. So I needed to acknowledge that. You know, in the North Zone, we have 33 of the First Nations, 8 Métis settlements, and we also support 5 out of the 6 regions of the Métis Nation of Alberta. So right from the get-go, you know, my director, Donna Matier, was very proactive. We started meeting weekly and bi-weekly with our tribal councils and tribal council health directors and our Métis Settlements Health Board, involving not only our public health and addiction mental health team, but also any other AHS program and service that the communities felt they needed to be able to provide the services that they needed while they were protecting their communities. Another big piece of it for us was, you know, I look at no barriers. We work directly with FNIB and with our leadership to support our communities during the COVID crisis. So we've done a lot of work, and you know, I will say too that it was such the Indigenous Health Task Force was such a great opportunity to work together and get to know the Indigenous team across the province. Being able to collaborate and work at that level was, you know, something that, you know, COVID brought us together, I think, as a team, and I really appreciate the leadership at that level as well, too.
Wonderful. Thank you so much for that. So we know that many of our people are going to be having conversations with their children and families this week as we remember and honor residential school survivors. So I think they would be very interested to hear your advice about what they should be speaking about in particular. So Marty, we're going to start with you and then go to Simon, followed by Shannon.
I remember listening to a presentation by Chief Willie Littlechild, and he's one of the commissioners for the Truth and Reconciliation Commission. And after he did his speech, he told a story. He was in residential school, But after he did a speech, he made one statement. He said, remember the children. And as we talk about our elders and we talk about people that have been through residential school, it seems to be a piece of history. So everybody thinks, well, that was so long ago. It's just, the people that are talking about it seem to be our elders. They're the elderly, right? And that statement alone just made me think that it wasn't elders that went to residential school. It was the kids. So when we're talking to our kids and when we're talking to our families, it really is important to remember that you, as a young child sitting across the table, going to school, are the same groups of people that were removed from their families to go to a different school for the sake of removing the Indian from the child. And I think that's a very bold and very stark reality that we all really need to face. At the same time, looking at the resiliency of our elders and our elderly, recognizing that that's very important. We work with such a very strong, diverse group of elders in our communities, and the vibrancy and the resiliency and the stories that they tell, regardless if they're bad or if they're good, within residential school, just still speaks to the idea that as a people, they can get through it, and they're going through it, and they're working through it. And I think that matching the difficulties of the experience with the resilience and the strength that our elders have, I think is very important, because I think that story needs to be linked from the child to the elder.
I think to sort of build on that, I think a big piece about understanding Orange Shirt Day is being able to find ways to honor the survivors, but also to really embrace that every child matters. And when we say that every child matters, it's about raising a child in a holistic manner. So looking at the strength-based of avenues and looking at the physical, mental, spiritual, and emotional aspects of a child to ensure that they flourish and they move beyond resiliency to thriving. And we know that our communities are getting stronger. There's a greater amount of education success. There's greater advocacy for health equity. And that's what we need to acknowledge and build on. And as a health organization, we can collaborate and work together. And so those are the important pieces to remember, and also just to honor the truth and share what your understanding is, and seek additional education, seek greater information, and honor the youth, or I should say honor the children, because every child does matter. Thank you.
Thank you, Marty and Simon, for sharing that. I've been prior to coming into this role with Alberta Health Services, I worked in education for 9 years. And a big part of the work was around, supporting our teachers and our students in understanding the history and the historical trauma of our people. And Orange Shirt Day, for me, in that context, really helped to provide a platform in which our teachers and our youth were learning in a different way, in a way that was, as Simon said, that was honoring our children and acknowledging that every child does matter. Orange Shirt Day, like I said, for me, was really about creating a space, and a space that was safe to learn more about our history of residential schools. And I think the only other thing I will say is, don't forget, September 30th, wear your orange shirt.
Wonderful to the three of you, and thanks so much for not just sharing your knowledge, your experience, your advice, but also sharing yourself with us. I'm hoping that this isn't just on September 30th, that this is an ongoing life learning journey for all of us, and that we should always have these types of conversations, not just on one day or the week prior to that. So let's put a bit of challenge out for ourselves. I know that each of us has a role to play in ensuring our health system welcomes and respects Albertans of all cultures, traditions, and beliefs. And I really encourage everyone to complete the Indigenous learning courses, which I found to be absolutely fascinating and so helpful for myself to sort of reflect and think about my own knowledge and reconciliation. But really also visit the Indigenous Health page on Insight to see all the resources they have to offer. And next Wednesday, as Shannon said, please wear your orange shirt to show your support for reconciliation. You can also upload a picture of you and your team wearing orange shirts to Insight, So search Orange Shirt Day on Insight for more information on how you can do that and to learn more about Orange Shirt Day. So just on a final note, I want to talk just a bit about masking. Can't forget about COVID, of course. It's still very important that we continuously wear our medical masks in all patient care areas and any place, including corporate areas where we can't maintain 2 meters of distance between individuals. We wear these masks for our patients and for each other as they help protect us and reduce the spread of COVID-19. But it's also important to remember that it can be hard for some people to hear us clearly when we are masked. As I mentioned before, I've experienced that with both my parents who have to wear hearing aids and don't hear as well as they used to. And we know that good communications is critical to providing care. So just a reminder to all of us, please try to enunciate and speak as clearly as you can at all times, because I'll make sure to do the same. So thanks again, Marty and Simon and Shannon. Fabulous speaking with you. Please stay well, and thanks to everyone, and we'll see you again next week.
Together, we do amazing things every day.